Hi, everyone. I'm Jennifer Surratt with the Center for the Study of Human Health. And we want to welcome you to this talk on social isolation in older adults. And this is part of the speaker series we've been having on isolation and health in general, thinking about these issues in terms of the isolation we've all felt during COVID and the pandemic and all of that. So we appreciate you being here. This is being recorded. If you are a participant, you can use the Q&A button or the chat box to ask questions. The format is going to be, I'm going to ask questions of all of our participants, then we'll leave some time at the end for audience questions. So I'm going to start by introducing our wonderful panelists. Suzette Binford is a therapeutics program manager for the Charles and Harriet Schaefer Cognitive Empowerment Program. Thanks to a generous gift from Cox Enterprises, Inc. and the James M. Cox Foundation, Emory University and Georgia Tech have partnered to offer this first of its kind innovation lifestyle enhancement program for people with mild cognitive impairment and their care partners. The program promotes joy, purpose, health, and wellness and seeks to empower people affected by MCI and their best lives. And live their best lives. Prior to joining the Cognitive Empowerment Program team, Suzette served as a program director for the Atlanta region of the Alzheimer's Association Georgia chapter, where she helped develop programs and services for people living with early dementia. Suzette has a bachelor's degree from the College of Charleston and a master's degree in clinical counseling from the Citadel. She's been working with older adults with cognitive impairment since 1993. And I also want to thank Suzette for helping me identify our two other amazing panelists. So Heather Bogle received her Bachelor of Social Work from Indiana University. She has been working with Alzheimer's patients for almost 10 years at the Fountain View Center for Alzheimer's Disease. She was drawn to this type of work after her father had been diagnosed with Alzheimer's disease in the year 2000. She is active in working with the Georgia chapter of the Alzheimer's Association and is a team captain for the annual Alzheimer's Walk. Although a Hoosier native, she has lived in Atlanta since 1985 and calls Atlanta home. And finally, Ginny Helms is the president and CEO of Leading Age Georgia and is guided by the association's mission to advocate for and support mission-driven members who serve older adults and the vision to be the trusted voice in aging services. Ginny works with the Leading Age Georgia board members and Leading Age National to advance the association's strategic initiatives, including helping members create and maintain cultures of well-being for residents and staff, fortifying the workforce, championing the well-being of older adults, increasing awareness of positive aging and member organizations who foster positive aging, promoting the mutual interests of members and ensuring that funding policies and regulation support the work of leading age members. Prior to joining Leading Age Georgia, Ginny served as Vice President of Chapter Services and Public Policy for the Alzheimer's Association of Georgia, where she helped develop vital programs and led legislative efforts. She has a bachelor's degree from Oglethorpe University and a graduate certificate in gerontology from Georgia State University Gerontology Institute. She serves in the advisory committee of the Culture Change Network of Georgia and serves on the governor's older adult cabinet and a number of nationwide public policy committees. So I want to thank all of you for being here. You're all amazing experts, and I can't wait to hear what you have to say about this important issue. So I'm going to start it off by asking, how do we think about and define being old? What terms do we need to think about using and not using? And Suzette, I'm going to ask you this one first.
Yeah, thanks, Jen. So the way that older people are defined and treated as a part of society around the world differs really greatly from culture to culture. So today, we're going to, for the purposes of our discussion, we'll talk about the United States and how we see and treat older adults in the US. But in this country, the average lifespan in the 1800s was only about 40. So it's almost doubled in the last 200 years. It's now about 78. So people are living a lot longer, and it's one of the reasons that the incidence of Alzheimer's disease has increased so much. And it's why we have, this huge demographic bubble of baby boomers in the population who are aging. 10,000 baby boomers turn 65 every single day. So we've got a lot of older people now. And because there are so many of them and the age range is so wide, older adults have probably the most diverse lifestyles of any age group. Some of them are still working, some people have retired, some of them are super healthy, some of them have chronic health issues, some are raising their grandchildren. So I think that in itself has affected what we really think of as old. And polls show that the older we get, the higher we feel the bar is for being old. So in one poll, they polled people over 60, and only 16% of those people thought that 65 was old. So I think that's going to continue, especially because, you know, anti-aging is a multi-billion-dollar business in this country. As long as being older or old is something that's looked at negatively, I don't think, you know, that's going to change much. People are going to, you know, want to be younger, seen as younger. But in terms of what verbiage we use, I think most people dislike the word elderly because it sort of implies frailty and disability, and senior has lots of other meanings attached to it, like a senior in high school or a senior in college. And so that diffuses the meaning of that a little bit. So I think most people feel comfortable with older adults. Now in geriatrics, sometimes you'll hear people referring to the younger old or the old, but those terms aren't used so much in the public spaces. So generally we say older adults.
Ginny, Heather, anything that you want to add?
Well, I really like the way that we're saying older adults instead of elderly and that sort of thing. So I fall in that category up there. So I like it. I feel younger every year.
Agreed.
And I think Suzette framed it beautifully. And I think that she's right, that there's such a variety in older adults in terms of what their age looks like, both physically and how engaged that they are. And I think she's right on the target too, in terms of the baby boomers going to play such a big role, because they're the hold the pickles, hold the lettuce generation. And that means that we have to be tuned into that as we serve older adults, whether it's through healthcare or whether it's through housing. It means really understanding the cohort and seeing what their needs are.
Right.
Excellent thoughts. Thank you. What can you tell us about the history of care and housing for older adults? Suzette, let's start with you again.
Yeah, so especially before the Industrial Revolution, a smaller number of people lived in the cities. Most of the folks lived in the more rural areas. And so more than one generation of families typically lived together, and you took care of your elders, of older adults. But even at that time, there were situations where people needed care. And so they had what were called at the time homes for the aged, or that they were funded by benevolent societies and charities. And then you also had this category of institutions that were called literally poorhouses. People couldn't afford any kind of care, and the conditions there were really, really horrible. And then one of the milestones was the tuberculosis epidemic at the turn of the century, the early 1900s, because they started to create these institutions to provide care for people with chronic illnesses. And that's when the government started getting involved in funding facilities. So that was really a turning point in the history in the United States of caring for older people. And another big turning point was in the 30s, the creation of Social Security, because that eventually ensured that most people had some income after retirement. And then a little bit later on in the century, you started to see the nursing home industry emerge. The concept of retirement homes had actually been around for a little while, but the assisted living facilities started popping up in the latter part of the 20th century because people really wanted to have more options that were more tailored to the level of care that they needed. So we've seen a lot of change in our fairly recent history in the US, for sure.
It's really interesting, the connection of tuberculosis. I did not know about that. That's really interesting. Ginny, Heather, anything to add?
Yeah, I'd like to add that I think that life plan communities have emerged as a really desirable option for older adults. And with the life plan communities, they're designed so that a person can move in independent. That's where they start out. And then if they need more care, then they move into assisted living and nursing home. And the interesting thing to me about this is that most people who move into life plan communities are real planners. They plan so much better than I do, it's unreal. But it's also very interesting that the average age that a person moves into independent living in a life plan community is 84. And I find that very interesting. And I will say at this one community I visited, there was a lady and she was in her 70s. And I said to her, well, why did you move in so young? And she said, because I wanted to build my tribe. And she said, and I did. And she said, my husband moved in with me. And then after he passed away, I was still okay because I had my tribe. And she said, and I do what I like to do with those I like to do it with. And so I thought that was very wise. And I think that it behooves us to learn about these different options ahead of time before we need them.
That's a really lovely story. And while we're on this topic, I was hoping that you all could sort of clarify the current options for housing. We've heard assisted living, we've heard nursing care, I know there's memory care. So can you sort of just define what the current options are and why somebody would choose one option over another?
Yeah, I can start us talking about that. So of course, everybody wants to stay at home for as long as possible, right? And for people who have the financial means to do it, even if you need care at towards the end of your life, that's possible. But for a lot of people, it's not possible. And I think it is important for us to remember that there are a lot of disparities in access to these kinds of care, depending on economic factors, a lot of different social factors. But current state is that if you're a healthy older adult, you might live at home. If your income is on the lower side, you might potentially have the option of a publicly funded or the public, some assistance with funding, with housing. And those publicly funded housing centers are really, some of them are really nice now, what we think of as like Section 8 housing. It's not, in a lot of cases, it's not what it used to be. Some of them are really, really nice. So that's one option. If you can't necessarily live in the home that you've been in your whole life, but your income is fairly low. So then there's another category. We talked about assisted living facilities before. And with assisted living facilities and personal care homes, they provide assistance with your activities of daily living, ADLs, which is like dressing, grooming, bathing, toileting, eating, things like that, to the degree that you need it. And some of these facilities now, as Ginny alluded to, have levels of care. Many of them have, within the assisted living facility, they have what are commonly called memory care units, which in those units are generally people who have dementing illnesses, or they might be in need of wandering or at risk of wandering. So that's another level. The other option, if assisted living or personal care home can't meet your needs, is a skilled nursing facility, commonly called nursing homes. So people just go to a skilled nursing facility for rehab. So that's if you've had a stroke or broken your hip and you just need to rehab for a while. And some people in nursing homes, skilled nursing facilities, are long-term residents. So that brings us to the question of how these different things are paid for. And I think there's a lot of misunderstanding out there in the community about how they are paid for. A lot of people think that Medicare pays for a lot more than it does. So Medicare only pays for the rehab with limits. Everything else is paid for out of pocket, with these exceptions. If your income is low enough to qualify for Medicaid, and that funding is limited when you're talking about personal care and assisted living, there are a lot of qualifications for it, but and it's just for a few designated facilities if you're talking about assisted living and personal care. So when you're in a nursing home, again, if you're there for rehab, Medicare helps cover. If you're there long-term, it doesn't cover, unless you have a long-term care insurance policy, which the vast majority of people do not have. It's something that you purchase, when you're healthier, and gives you kind of most of the policies have limits on what they cover, but it usually really helps. So I hope that helps explain a little bit how the payment system works, because it's really complicated.
It really is. Thank you for that. Any other details you think are important, Ginny or Heather?
Well, I also wanted to add that some people do qualify for VA benefits that can be used in assisted living as well as nursing home care. Doesn't cover all of it, but it does help if you qualify.
And also, I think it's always important that people who even think that they might need care in the future, go ahead and do some planning, check out places.
Right.
Because, like, for example, for affordable housing, there's not enough affordable housing to go around. And so there's an average 2 to 3 year wait for that. And then also, I think people need to know the quality of care in different places and check them out. Like, I'm a huge fan of the Fountain View Center for Alzheimer's disease.
Thank you.
And, the different things that they've paid attention to, like neighborhoods. Neighborhoods are important. They have
Right.
neighborhoods. They have natural lighting. They have all of these different things that they really, really look nationwide at best practices for all the different components of the building itself and for programming. And so I think it's important that people learn about the different options, because a lot of times those decisions are made in crisis. And when you're in a crisis, then your decisions sometimes get made for you. In life plan communities, it's the older adult themselves making that decision, but a lot of times assisted living or nursing home, it's the family, and
Right.
it pays to know the options.
Yes. Well said, Jenny.
Yeah.
I have a follow-up question. We are having, particularly in Atlanta, we're having an affordable housing conversation, and I think it's a national conversation, but being in Atlanta, we hear a lot about it because it's a topic in the mayoral race. I don't hear about older adult care in this conversation. Why do you think that it's being left out, and how can we start including older adult care into the conversation of affordable housing? Or maybe I'm just missing it.
Well, we are having that conversation on the national level. And in fact, the act that is being considered before Congress right now includes funding for new 202 housing, which is elderly housing. And so I think that's really a good thing. Where I would like to see the city or the counties participate is there are a lot of mission-driven affordable housing providers who would love to expand or provide more housing, but they're going to really need some land to do it on. And I think we need to see more partnerships along those lines, because I don't think some people understand that a lot of times with older adults, if you don't have a lot of funds, you don't have a lot of options. And so unless you end up in long-term care on Medicaid. So I think that you're exactly right. We need to be having more of those conversations.
Anything else? Oh, I don't know who froze, if it was me or you all. There we go. I'm back. Apologies for that. I'm not
No
sure how, you know, we're living in this age where we're freezing in these events now. But I'm sorry, Heather or Suzette, anything to add? Or maybe
Well,
you added-
I'm glad you're having those conversations because about affordable housing at the national level and what we're hoping for here in the state and counties, because people don't always have to live in a nursing home, but if they don't have the money, then that may be their only option because of Medicaid. And that is such an expensive thing. I just would hope that we can find some different type of housing or more housing for seniors that really, or older adults that don't necessarily need to be in a nursing home.
Well, thank you for saying that, because I will tell you that this upcoming year, we'll be working on a legislative initiative to ask to have Medicaid funding for assisted living. Right now in Georgia, they only allow it in personal care homes, 24 beds or less. And as people need more nursing, and yet they don't quite, nursing oversight, but they don't quite yet need nursing homes, we need that as an option. So right now, people who have adequate funds can get assisted living, but people with limited income cannot. And in other states, they allow it. So this will require a change in our state plan that's approved with CMS. But it's time to work on it, because so many people in affordable housing end up going directly into nursing homes because they don't have that assisted living option.
Exactly.
Is there a name to that bill so we can keep it, that you know of, that so that we can keep an eye on it?
No, we do need to give it a name, don't we? Medicaid and assisted living is what we would reference it as right now.
That's very clear cut. Heather, I'd like for you to start with the next question. How has isolation or social connectedness been traditionally thought of in our current models and options for care and housing?
Well, I think in any of these models, whether it's independent, assisted, skilled care, personal care homes, there is a social model. There are activities and outings and things designed for each place. And so sometimes this is more than maybe the senior had at home as far as socialization and activities and a tribe, as Jenny mentioned. So I think that's what is great about those types of communities. Now you've got your friends and activities and outings. So that's a good thing. You kind of acclimate to a new community.
Can you talk about any of you why? I mean, it should be obvious as to why do we do this, but what are the known benefits of attending to social connectedness and isolation?
I can speak to that first if you'd like. I think it's very important for people to keep their connections and friends and things of that nature. I've seen people that have maybe lived alone and have gone into the hospital and have come to us, and they have pretty much thrived when they get into more of a structured setting with more interaction. Sometimes they're living alone with no access to family, or maybe a neighbor's notice that they're not, getting out and doing things. So I think it's very important for psychosocial, for people to be in some sort of social setting.
Yeah, and I will add to that, Heather, that if you just look at the research, people who are particularly older adults who are more socially connected tend to live longer. Their physical health tends to be better, and their psychological health tends to be better. So there's a good bit of data out there about the benefits
that supports it.
Socially connected. And for example, in our program for people with MCI, it's also the thing that people like the most about the program. I mean, we try to do cognitive training and nutrition and coping skills and all that, but they find that the greatest benefit comes from the socialization.
Wonderful.
And I think too that long-term care providers have learned this. There are a lot of longitudinal studies or happiness studies, and it shows that for the most part, people want connections. They want the sense of community. And so I think a lot of retirement communities are really focusing on building community. And they're also really thinking about engaging the older adult to say, what does that look like? And so they will engage them from everything from the renovation and deciding, do we have a big formal dining, or do we have like almost like a pub or a club environment? And then what kind of activities? And they're building in the residents to even head up committees and just so much more engagement with the residents themselves. And also to really make sure they're staying connected to the outside community. So they build it within, they go out, and that would be things like going to the symphony or the High Museum of Art, or bringing in orchestras or music. But I think it's really kind of cool that I think that they've learned, sure that there are introverts who don't need a lot else, but for the most part, we're seeing a real connection to being with other people and doing what you love with who you care about.
Right. I would agree.
I mean, it's what we all want.
Yeah. And, I think lots of people think, oh, mom's going into assisted living or a nursing home, and she'll get lots of socialization. And on one hand, that's true. And we do a lot to, encourage them to interact with each other. And we've got great activities, but you're right. It's not the same as being connected to the outside world or to your family of origin. And I used to work in nursing homes, and I would see lots of people who never got visits from anybody. And we have to think about sort of the levels of socialization. You do have some built-in socialization, but you also need that connectedness to the bigger community and family and those kind of things.
Right. I agree.
Yeah. And I think one of the things that's important to think about is kind of like, you all pretty much said this, but the geographic location, right? If it's way on the outskirts of the city, or in the middle of nowhere, you're not going to have much of that interaction.
Right.
I have like sun or something in my face, so I'm so sorry. Okay, so let's get to sort of the meat of the discussion and talk about the role of COVID. So how has COVID impacted isolation and these attempts to increase social connectedness in these communities? And Heather, do you want to go ahead and take this one first?
Yeah. So we all know that we had to shut down in senior living places and nursing homes, et cetera, to protect the residents. And so that shut the door for a lot of those things that are very important. The socializations, the families coming in, going to the outside world. So that has taken a hard toll on people living in those types of communities. So on the positive side of that, we experienced different ways, and I know other communities did too, with technology to connect families and friends to the resident that maybe that hadn't even been thought about before on a regular basis. But programs were put in place for that system. And also, besides just the technology, phone calls, window visits, different, things like that to keep the family still connected, and the church and people from the outside, even though they couldn't be in person.
Yeah, we found the same thing. We found that in the beginning of the pandemic, we were seeing the older adults were the most vulnerable. And,
yes,
even though all of our communities really understood the flu and could keep that under control and keep people safe, when the pandemic hit, it was something we've never seen before.
Mm-hmm.
And so early in the pandemic, 50% of the deaths in Georgia were in long-term care. So that's what scared everybody and put the total brakes on having visits inside. And so early on, all of the focus was on keeping the older adults safe. But then what we saw over time is that the isolation was as bad as
Right.
the diseases, as the virus itself. And we found that it was leading to depression. We found that it was leading to people becoming more frail.
Yes.
And it became a huge concern. And that's what led us to really push hard to have the vaccinations made available for all senior housing, whether it was independent living or in our affordable housing or assisted living, as well as nursing home, because we knew that the way to move forward with the addressing the isolation was to get people to where they could be safe to be among other people. And it was interesting too that, the residents in long-term care were very quick to agree to becoming vaccinated. And we saw that, most communities were 97 to 100% participation, but it was much slower with families and with the staff in terms of them being willing to get vaccinated. But I think that we all as an industry worked to keep them safe, but then also work on being able to get them connected. Everybody did the interim thing with the technology. It was really kind of cool that in addition to staff teaching residents how to use technology, that we saw residents helping each other learn how to do it. We saw residents teaching other residents how to use Instacart. And those things were really, really cool. But now there's been a lot of focus on having in-person visits again, and what do we do to keep people safe? And there's been a lot of emphasis on trying to get staff vaccinated.
Right.
And, there's mandates that are requiring staff in long-term care to be vaccinated, and in nursing homes, particularly through the CMS new guidelines. But that's been a big push. And I think that in addition to us seeing folks be socially isolated and the impact it has, I think that the pandemic really opened our eyes into what isolation does to a person in general, so that even as we emerge from the pandemic, there will be a lot more emphasis on what we can do to help individuals engage with others. I think we've really seen that we're social animals and we need connection. So it'll be interesting to see the changes that come out of this.
I agree.
Yeah, working at the Brain Health Center at Emory, I've heard anecdotally from people who do cognitive testing that it seems like people's scores have really dropped.
Oh, yes.
And we hear that from our participants in my program, that they feel like their loved ones really slipped. But it will be interesting over time to sort of compare this COVID period, the decline period, compared to, a similar period of time in sort of normal times. And I really do think that we'll see a decline in cognitive abilities for sure.
Yeah, that's really interesting. That'll be really important to do research on. I just have like a logistical question. During the initial stages of the lockdown, were residents able to spend time with each other?
Well, at where we were, yes. We did modify our activities and our dining and things like that, but we did have residents interacting as long as we didn't have any outbreaks.
Got it. And did that have, I imagine that would almost increase the sense of community and camaraderie. Did you see any of that?
Well, yes, I think that the staff became more like a family.
Yes.
We're big on person-centered care anyway. And so, just us all being involved in pretty much everything gave the residents a sense of more security per se.
That's great. So, Ginny, you kind of touched on this, but I'm wondering if you could expand a little bit on what have been some of the useful solutions to the issue of isolation, both during COVID, but also in normal times. And what can we learn from COVID, or what do you hope to see in the future to address social isolation?
I think that's a great question. I think too, that the pandemic showed us too how much older adults really value their family. I mean, they just really do value their family. And I think all of our different communities just really had to learn to do all that they could to connect them with technology. Seriously. This was, teaching people to use the iPhones or the iPads or Simple C or the different things like that. And if they couldn't do it, facilitating it, holding it for them, and doing those kinds of things. And the phone calls, the letters, we all recognized that they needed to feel they were cared about and connected. And I think that just like Heather said, a lot of communities really realized that the staff needed to be like the family. They needed to step up and deepen those relationships because of the impact of the isolation. The other thing is we learned that we needed to keep things going, like the exercise, or else people were going to lose their physical health as well. And I do think that we probably saw some decline for individuals who did not have regular therapists coming in and those kinds of things. So I think everybody made very good faith efforts, but I think also everybody really wanted the in-person visits again. And now we're facing colder months, and if we have more outbreaks, then you'll see communities really have to move towards isolating individuals again. So that's the reason why we really hope that more staff and families will get vaccinated. Heather, are you seeing the same thing? Are you seeing wanting to get the staff and the families vaccinated in order to make sure?
Yes, I know that we have a, by November the 15th, if you're working at Fountain View, you have to be fully vaccinated. So that's a good thing. That's a great thing. We've lost a few people, but not as many as we thought we were going to. And most of those folks were part-time anyway. The families have been great about, they're willing to show you their card when they come in. Oh, I've been vaccinated, I'm good to go. Because I think we're very fortunate in our community with families recognizing how important it is to keep their loved ones safe.
One of the other things that I hope comes out of this is that we pay more attention to the importance of social engagement, because at the end of the day, for older adults, this is not just a COVID problem. Traditionally, older adults tend to be more isolated. I have people tell me all the time, most of my peer group is gone. My friends and much of my family is gone. And so it sort of shrinks their social circle, sort of just as a function of being older. And so I'm hoping that with this focus on how important it is, that we can find ways to, engage more with seniors and with older adults in our communities, and to, have volunteers to come and visit and welcome people more into the community. I hope that will be a side effect of all of this going forward, that we pay attention to people living at home. Maybe they can't drive anymore. They have some disabilities and they can't get out. What about those folks? How are we going to let this inform how we treat those people going forward?
Yeah, absolutely. I mean, like we're mainly talking about older adults in facilities, but we need to think about extending what we're learning with COVID to those who are living at home, semi-independently or fully independently. Yeah, that's a really important point. So we know that there are vaccine hesitant people and people who are refusing the vaccine. If they are the family member of somebody living in a residential facility, are they still allowed to visit? Are there restrictions? I don't even know if that's legal, but what's the situation with that?
So they're allowed to visit, they're screened, they wear a mask at all times. And so they're only allowed to visit in the room or out in the courtyard area. So they're not to be around the other residents there other than their loved one. And they're to wear a mask at all times.
Okay, yeah, that makes sense. It's hard. That's hard to manage, I imagine.
Yes.
Can't even. We were talking earlier about the role of staff in keeping the residents and the older adults cared for and engaged. And we, have also, earlier we talked about some of the difficulties in finding good housing, and some of that has to do with staff. And we've heard horror stories about staff. And I'm wondering what your reflections on that are. How prevalent is sort of the bad staff? How can we avoid that issue? How can we find better staff and get them engaged and dedicated? Ginny, do you want to start with this one?
That's a great question. And I will tell you that in housing for older adults, staffing is the biggest challenge that there is. There's not enough staff to go around, and it's getting worse all of the time. And the problem is it's hard work, and the pay is not that great. For example, somebody that might want to be a certified nursing assistant can make more money at Target or at Amazon and not work as hard. And also nurses can make more money in other industries like at the hospitals. And so being able to pay them enough is a challenge. And particularly too, when you look at nursing homes, the predominant payer is Medicaid. In Georgia, about 80% of the beds are paid for by Medicaid, and Medicaid really doesn't pay enough money. And it's an issue that we're going to have to grapple with nationwide. In order to have adequate staffing, we're going to need to be able to pay competitive wages. The good news is that it does attract a lot of people that have the heart for it. And I know, like at one community, like at AG Roads, there's a man there who's been a CNA for 45 years.
Yeah, it's
and
amazing.
So I am sure that Heather will tell you too, that at the Fountain View Center, they have a lot of people who are compassionate and caring hearts and want to work there. And so we need more of those folks. I do think that we have to learn to really appreciate the folks in long-term care, in nursing homes, the staff, because I think through the years, the emphasis has been on the older adult, which is great. But in order to have that good care, you got to have enough staff. I know we worked with Carrie Teagarden, the AJC writer who covered assisted living and nursing homes for a couple of years and is back covering them again. And she said that when they looked at the surveys, they read the surveys of every single assisted living and nursing home in the state, and that when they found there were problems with neglect or abuse, that inadequate staffing was the root of it. I mean, that was in all of the cases. And so it just shows you that we have to have adequate staff, and we have to appreciate them. We have to make our nursing homes and assisted living's cultures where people feel appreciated and they really feel like their jobs matter. And otherwise it's going to continue to be a challenge. But this will be a challenge that we'll be looking for solutions for a long time. Just this week, this one group, Wildest, presented us with a white paper that said that one of the things that helps prevent turnover is when a staff person has at least 6 friends that work there. And so
Yes.
The friends really make a big difference. And then also doing fun things that they enjoy, get to know each other better and engage and do things outside of work, and which is great. And we're going to have to do those things, even though everybody's so worried about making sure the floor is covered. If we don't do those things, we won't have enough staff. But I'd love to hear, Heather, too, what you guys are doing to.
Well, we have what we call a focus group, and these are staff from different departments, and we're meeting at this point weekly, and we're challenging them to go out and let us know what people want. What is it that would make their jobs feel, better about what they do? And it was amazing that many of them said just a thank you noticing that from a family, for example, that we went above and beyond to make their, mother look clean and well-dressed for her visit, and just some thank you. I thought everybody would say, oh, I want more money. But that wasn't what the consensus was. They like working there. They just want to feel appreciated. So we have some programs we're doing to address that.
Good.
That's great. We've gotten to the end of our prefab questions. I know we have a few participants, attendees online. I've learned that some people didn't get the right Zoom link. So I think that is, I don't know how that happened, but that's an issue. But again, it's being recorded. But the participants that are here, if you have questions, again, feel free to put them in the chat box or the Q&A. And as we're waiting for that to happen, I mean, I was writing down questions the whole time, so I can keep this going. But I think that it'd be fun to get all of your sort of what in your imagination, what do you want to see? If we had the most idealistic situation for older adults in this country, what would it be? And we'll start with Suzette.
That's a really good question. And I think we can maybe look to Europe for a model that seems to be working really well there, which is it's sort of like a community with individual pods where a smaller group of older adults live together with maybe some help. And then the individual pods are connected with each other. And they really have adopted things like the Eden alternative model where of people and kids visiting and pets and plants and those kind of things. So making it as home-like as possible, because I think especially in the United States in traditional facilities in nursing homes, a lot of them feel pretty like it's a pretty medical environment. So if we could do something along those lines, that model, I think there's a community in the Netherlands that is sort of the one that people look to as the gold standard. But if we could do that or at least work towards that model, I think that would be a huge leap. Yeah.
I agree with that. And the other thing is, I think, when you start reading the longitudinal studies on happiness in older adults, the theme is over and over and over is do what you love with who you love. And, we're seeing things like spirituality really helps, and doing things for other people, doing the kinds of things you always like to do. Like I love bird photography, water bird photography. Well, how am I going to get to do that when I'm living in retirement community in the future? But even Suzette will tell you that when with the early stage work, it's helping people do what it is they love to do. And so making, adaptations where you need to. But I think that's the future of care for older adults, because the generation, the baby boomers, it's hold the pickles, hold the lettuce. And
right.
We're going to want that in our care too. I want extra pickles.
I want to pick my diet. Maybe I want organic food.
That's right.
Heather, what are your thoughts on this? Your idealistic, wildest imagination future?
Oh, goodness. Well, immediately I think about, I wish there would be more services in the home where people don't have to move out of their home just because they need a little extra help, but they really can't quite afford it. Or maybe their home needs to be modified somewhat and they don't have the resources to do that, like stairs and things like that. But I think people really in the beginning don't want to have to move out of their home and leave their husband or their spouse or whatever. So I would like to see us kind of start there with some things in the home.
That's really smart.
Yeah,
I also think about the possibility of mixed age
Yes,
groups
I like
living
that.
together. Do you have you seen any models like that?
I can't think of any, but I think that some probably exist. And I think that's a great idea. I really do.
Right. And I know when I visited one of the Eden alternative homes, nursing homes in upstate New York, I really loved that they had on-site daycare. And I think we were going to have to be thinking along those lines so that
I
the
agree.
staff have a place for their children when they come to work.
That is really smart. Yeah.
And I
And
know that, go ahead, I'm sorry.
no, you go ahead.
I was going to say that I know our older adults love children and pets. They love dogs visiting and children visiting and babies. And that's just, there's just such a difference when all of that is occurring.
Mhm. So I wanted to think back about the very beginning of our conversation and about how do we talk about and define being old. And I think that one of the connective themes throughout today's discussion really has been, that's been underlying, because we haven't really said it, is the stigma about being old, right? Because I think that the stigma leads to this lack of funding, or contributes to this lack of funding, right? Because it's not my problem right now, you know, and I'm not going to need it for a while, so I'm not worried about that kind of thing. What do you think about how to overcome the stigma related to being an older adult? What are some strategies you would like to see?
I'll give you one. I think we need to engage the mothers of legislators and get them to lean on their children who are making some of these decisions.
That is such a good idea.
I mean, you know, they listen to their mothers. So yeah, I think we probably should be just a little bit smarter about it. Because I do think, you know, like we go down to the Capitol and we ask for funding for home and community-based services every year. And it feels to some degree like we are begging. But I will say that that in the state of Georgia, we have a great share of appropriations on the House side, Representative Terry England. And I think him having cared for a parent with Alzheimer's made him more amenable to funding services for persons with dementia. And I do think it was that, again, that was that love of that parent that I think helped him focus that way. And I do think that we're going to have to do a lot more work to get them to, on the state and federal level, to really see the need versus just thinking of it as just an older adult or whatever. To me, the Medicaid rate shows that there is not really a true understanding of the needs of older adults and appreciation of what it takes to care for them.
Absolutely. I would love to see you show up at the Capitol with a bunch of legislative mothers and surprise them all.
Oh, I would love to do that.
That would be so amazing. Heather, Suzette, do you have thoughts on overcoming this stigma?
Well, I think older adults are very valuable to society. And, you know, I think that people need to realize that there is still value, knowledge, wisdom, experience, and maybe that's a start, not just like, oh, they're ready to retire, so they don't matter anymore or whatever. Does that make sense?
Yeah, kind of in contrast to these American ideals of productivity.
Yeah. I also think, you know, we have a huge challenge to overcome in terms of media and the way that, you know, like in ads and advertising, everything is, you know, it's young, and the younger the better. And how we start to overcome that, I'm not sure, but I think one step would be to really advocate for children being more exposed to older adults from a young age.
Yes.
And I think if we could find ways to sort of operationalize that and build that into our system, where kids have the chance to interact more with older people, hopefully as they get older, they will have sort of a different attitude about their elders. So, but that's a tough one. The stigma is a tough one. Yeah, because like I said, anti-aging is a multi-billion-dollar industry in this country. So it's a lot to overcome.
Yeah, we're constantly being fed messages that we need to fight age.
Anti-wrinkle cream and
that was one I was thinking of.
Gray hair. I liked the thought about the tuberculosis outbreak kind of changing a lot of the situation in elderly care. And I know we already kind of talked about the role of COVID in the future, but just your personal opinion, do you think that things are going to change once COVID dies out? Do you think that the improvements that we hope to see or that we're kind of seeing right now will actually continue?
Our industry really thinks that it'll be a shift. They think that while this one pandemic is getting under control, that there might be others and that we have to be ready to face them. So I think we're seeing changes in thinking, like instead of having rooms that have 2 or more people in a room in long-term care, they're looking at, we should probably be able to have 1 person to a room, and we should probably have more like neighborhoods and being able to like seal off a neighborhood if there was an outbreak so that the rest of the community can continue to thrive. So I think we'll see that. I think we'll see better infection control measures. I think that we learned a lot about the problem of isolation and that there will be so much more emphasis on keeping older adults connected. And I think it's like Suzette said too, we'll be paying attention to what those folks say. And we'll have to be paying better attention to staffing too. I mean, that's huge. And I love what Heather and her team does in terms of the focus groups. We're going to need more of the staff driving ideas in the future if we're going to really have enough staff. So I think some good things have come out of this.
That's great. Heather, Suzette, any thoughts?
Yeah, the other silver lining that I can think of is the technology piece.
Yes, I was just thinking that too. Yes.
We've learned how powerful that tool is.
Yes.
And hopefully going forward, we can, and even in our program, we shifted from doing things virtually, and it made us realize we can reach so many more people.
Right.
With things virtually. So I think that will also be part of the shift that we see.
Well, it's just part of the program now. At Mountain View, for example, just, virtual calls or whatever with families. That's just part of the deal. We never thought about it on a consistent basis before.
Or realized how easy and beneficial it would be.
Right.
Yeah. Well, that's it for my questions. I want to just ask you if any of you have any closing comments or thoughts that you'd like to share.
I just wanted to say, if there are any students watching today, I applaud you for being interested in this topic, and please, spread the word and encourage your fellow students to go into the study of geriatrics and of older adults, because historically we've had sort of a dearth of particularly medical students wanting to go into this area, and we see in the future that might be an issue. So I just encourage those of you watching to think about geriatrics and going into this field as a career, because it's so rewarding.
And you'll always have a job.
Yeah. Job security.
Yes, thank you. And Jenny, continue at the Capitol to get some things going there in a positive way, which you do all the time. So great.
You're so kind. I say ditto to what they've said. I really like the different thoughts and the concepts about like tuberculosis changing things and the fact that COVID's changing things too.
Yeah, I personally learned a lot, and I appreciate all of your time. yeah, we'll get the recording up soon. And so we can have an even wider audience for this. So
Thank you.
thank you so much.